Tonight, the WSU College of Nursing is pushing a pilot program, which would be just the second of its kind in the state. If all goes according to plan, advocates say more Eastern Washington nurses will be trained on how to examine and care for victims of sexual assault. They say if they had the money, this program would exist already. They told our Taylor Graham today it's not up to them, it's up to the state legislature. Taylor.
Well, right now, nurses in Eastern Washington have to pay their own way to this type of training at Harborview Medical Center in Seattle. Supporters say if the legislature approves money for a new program at WSU, it'll open up access, encouraging nurses to get training on how to make sure they're not adding to the trauma these survivors have already experienced.
If you think about the courage it takes for somebody to just show up to the hospital, that's huge. And then to be told we can't do that.
It's not uncommon for sexual assault survivors to hear that when they ask for a rape kit at hospitals across Eastern Washington. But it's not that nurses don't want to help, it's that they don't feel confident in doing so.
And there are a lot of nurses that don't really want to sit up on the stand and defend their practice when they only do maybe one kit a year, or maybe this was their first kit ever, or maybe they've done 3 in 10 years.
Multicare's Jennifer Jordan has done countless kits over the years.
On a good day, if it's a really quick one, is about 3 to 4 hours. I've spent upward of 6 to 8 in some cases.
She's a sexual assault nurse examiner. As a SANE nurse, she has 40 hours of extra training on how to care for sexual assault survivors. She had to pay her way to Seattle to get that training. Not everyone can do the same.
Some hospitals can't let a nurse leave for 40 hours for a training because they don't have nurses to back up her shifts.
With state money for a pilot program at WSU, that trip would be a lot easier for Eastern Washington nurses.
If it were more readily available, more affordable, and they had access closer, I think we would have a much larger pool.
More SANE nurses, Jordan says, would encourage more victims to come forward to an emotional support system in an already painful process.
I think regardless of where you live, you should have access to the best quality care. And that's one of the things I want to ensure is that, on the worst day of your life, you can go to a hospital and have a SANE nurse take care of you.
Now, the House will be holding a public hearing on this budget provision tomorrow. In studio tonight, Taylor Graham, 4 News Now.